My name is Balogh. I am a physical therapist. I have been practicing as a physical therapist for 10 years, and then I've owned B Physical Therapy for just over 6 years now. I have my bachelor's degree from UCF, go Knights, and then I also have my Doctor of Physical Therapy also from UCF. What inspired me to become a physical therapist was when I was a teenager. I was training in the off season for basketball, and I suffered a back injury, actually had an MRI that showed 3 bulging discs, and I was fortunate enough to meet a physical therapist who was also named Steven, who really helped me and inspired me to get better, because I was in a pretty upset, kind of depressed state with the injury, wasn't able to play, wasn't able to work out and train. And immediately when I went to see him, he said, yeah, we're gonna get you back. And he gave me a lot of hope. When I started B Physical Therapy, my mission was to try to really revolutionize healthcare and change what physical therapists do in the healthcare community. And that really is being the primary care providers for any like musculoskeletal type injury. So if you have a strain or sprain, we would love to be the first option, and we're well qualified and we're highly educated as doctors of physical therapy to be able to evaluate your injury, evaluate your symptoms, and then perform appropriate treatment or refer you out to the appropriate specialist if that's something that's needed. We do exclusively one-on-one sessions. We feel like we can provide the most value, contrary to maybe what other physical therapy practices do. We really focus on the quality of care. Every session is entirely one-on-one with myself or your doctor of physical therapy. And that way we can spend the necessary time working through, pain, movement patterns, really getting you comfortable with what you're gonna be doing between each session to continue to progress and get back to reaching your goals. Some of the procedures that I include really like hands-on manual therapy, being able to feel where patients are having their injuries, where they're having issues, and being able to usually have a pretty immediate effect on their symptoms and how they're feeling. I also specialize and am certified in dry needling, which allows us to really target the muscles in a different way, get deeper into the muscle tissue, and allow pretty rapid decreases in pain. So those are 2 of the areas that I really like to specialize. The heart behind our mission is that we really strive to improve everyone's story. So whether you interact with us as a patient, even if we just do a simple consultation, we want to have a positive impact on your life in some way, and we want to inspire hope. A lot of people who've had an injury, they've been suffering with pain for a really long time. It's frustrating, it's really depressing, and we want to provide hope that you don't have to live every day with pain and that you're going to be able to do the things that you really love and enjoy. The ultimate goal for any of our patients is helping them meet their personal goals. Whether that is being able to walk a mile, whether that is being able to run a marathon, whether that's, getting back to the gym, whether it's CrossFit or some kind of competitive lifting, whatever that goal is, that's what we want as our target as well. So we're gonna come along on that journey right alongside you to make sure that whatever your goal is, we're going to reach that, and we're not going to discourage you from reaching those goals. We're going to try to empower you and really give you hope that you can do that. I would really love people to understand that physical therapy is not only for when you're injured. Physical therapy takes on many different forms. One of them is looking at injury prevention. How can we limit your risk of injury, especially for athletes? There's a lot of research, there's a lot of data that shows being proactive about things and trying to pick up on trends and testing that helps reduce your risk of injury and addressing those before things happen. We've all seen how much athletes get injured and what the current injury trends are, and we want to try to stay ahead of that and try to make sure that when someone comes in, that we're not only getting them back to where they were at previously, but maybe we're exceeding that because that previous person was injured. So when you come in, we want to make sure that not only we're rehabbing any injuries, but that we're also looking at how can we potentially prevent injuries in the future. Our top core value is to improve everyone's story. So anyone that we come in contact with, we want to try to help them in any way. Even if they don't necessarily become a patient, they don't go through a treatment plan, we want to be able to send people in the right direction, whether that's a referral, whether that's just giving them the appropriate information. We want to make sure that we're providing a positive impact on every single person. Everyone's on their own journey, and everyone's at a different point in that journey when they reach out to us. And we're trying to just make sure that we always improve that journey. And then our other core values just fall in line right after that. So the problem in the community that we're really trying to solve is we want people to realize that pain, imaging, whatever your diagnosis is, that's not defining your life. That's not holding you back. I have 3 bulging discs in my back that I've had since I was 15 years old, and I've lived with those now for well over half my life, and that doesn't stop me from being able to do the things that I really love and enjoy and be active. So for a lot of people in the community, they're told that they can't do things because of what their MRI shows or what their pain is, and we want to convey the message that shouldn't hold you back. There are ways that you can get back to doing the things that you really love.